Okay, so I think we're ready to get started. Good morning, good afternoon, everyone. My name is Sophie Boisson. I work at the Water, Sanitation, Hygiene and Health Unit at WHO. Today we'll hear more about the toolkit, which is called Wash and Health Working Together, a practical guide for NTD programs. Just a quick note on the technology. So you'll see a chat box on the bottom right corner. So if you haven't done so already, feel free to introduce yourself to other participants. And if you have any questions during the presentation, you can enter them in the chat box and we will address them after the presentation. So during the webinar, we'll try to address all the questions that we receive, but if we're not able to because of time constraints, then we can continue this conversation on the Susanna forum. So before I start, I thought I would give you a quick background, especially for those who may not be too familiar with the term NTDs or neglected tropical diseases. Should we go to the next slide? Are you able to do that, perhaps? Yeah. Okay, so on the next slide, you'll see, can you move on to the next slide, please? Yeah. So this slide gives a broad introduction to NTDs, but I won't go through it in much detail, but I just wanted to highlight that neglected tropical diseases affect over 1 billion people, especially in tropical and subtropical countries, and they manifest. There's lots of a number of pathogens that may be involved in NTDs, and they manifest in a variety of ways. But what's important to remember is that these diseases thrive among communities that are often the poorest and the most vulnerable. And the same community, those communities are often the same that also lack access to even the most basic water and sanitation services. So, next slide, please. One before. This slide just illustrates that water sanitation and hygiene is really important for prevention and control for many of these neglected tropical diseases, but it's also really crucial when we think about the treatment and in order to treat the morbidity related to those diseases. So having said that, I think there is the clear rationale for collaborating on WASH between WASH and NTDs, and it's important for WASH to target communities that are affected by NTDs because they often lack WASH services, and therefore collaboration helps them improve the targeting of their efforts and improve equity. So having said that, I mean, in recent years there's been really a growing interest for doing cross-sectoral work between WASH and NTD actors. And in 2015, WHO released a global strategy to try and promote further this collaborative effort. And we've seen that in many countries there's been action that have been taken to try and to either pilot or implement joint initiatives. But also we've noticed that they have often faced a lot of challenges. And so in order to address some of the challenges faced, WHO, in collaboration with the Neglected Tropical Diseases NGO network, have developed this toolkit, which really aims to provide some step-by-step practical guidance on how to work across sectors. And I wanted to note that one of the target audience for this toolkit is NTD programs, but it's also incredibly relevant for WASH actors who want to be engaged in joint initiatives. So I just wanted to also highlight that the development of this toolkit has involved a wide range of partners and input from a lot of countries. So I wanted to say thanks again to all of those who contributed to the toolkit, but I also Susanna for hosting the webinar today. So with that in mind, I would like to introduce Lee Wolgmuth from Sightsavers, who is also the chair of the NNN WASH Working Group, and Yael Velleman from the Schistosomiasis Control Initiative. They will take you through the content of the toolkit. So Lee and Yael, over to you.
Great. Thanks very much, Sophie, for this introduction, and welcome everyone. It's great to see so many people from the WASH sector taking an interest in this toolkit. And maybe it's worth starting this by emphasizing that yes, the title of the toolkit specifically says that it's about NTD programs and supporting those. But in actual fact, I think you'll see throughout this presentation that this toolkit can be used by pretty much everyone who's trying to achieve improved health impact and increased access to basic services in line with the Sustainable Development Goals. And it's basically an illustrated way of working across sectors, which we all know is a very big challenge, especially in the WASH sector. So before we start on the actual components of the toolkit, a few introductory remarks. So what's the purpose of this toolkit? And it really is all about supporting this intersectoral collaboration, this magic issue that we're all pursuing on WASH and neglected tropical diseases, to build a strong working relationship between different agencies and government ministries and development partners. It's to have the right kind of program structures. It's to build a good planning approach that is more sustainable and successful and better at achieving impact. But it's also to make sure that the right sort of public health interventions get implemented, but also that they're implemented in the right places and the communities that need them the most. Okay, next slide. So this is just a diagram that that sort of tries to show that as distinct sectors, and in this slide you've got the health sector, the WASH sector, the business sector and the education sector. We may all have specific objectives that we're working towards, but what this toolkit is about is the middle of the Venn diagram. It's about the shared outcomes that we're trying to achieve and ultimately the shared impact, which is basically what the Sustainable Development Goals are pursuing, which is shared equity and prosperity and increased well-being. And the whole point of this toolkit is rather than trying to get one sector to buy into the objectives of another, or to say how do we convince them to implement what we want, it's about meeting in the middle and trying to achieve that shared impact. So what is this toolkit based on? And as Sophie alluded to, it's been a long process with a lot of consultation and a lot of documents that it's building on already. As WHO, there are two main guiding documents that this toolkit responds to. One is the roadmap on NTDs, which was published in 2012, which sets very ambitious targets for NTD control and elimination. And then in 2015, we had the Global Strategy on WASH and NTDs, which defines the nature of the WASH interventions that need to be implemented to achieve the objectives of the roadmap. But if you like, this toolkit puts that rhetoric into practice, and it shows exactly how you would go about formulating a joint program to deliver those interventions. And then a little bit more niche, but in the trachoma community, there's been a sort of preliminary exercise to this toolkit, which was specifically on the WASH interventions for eliminating trachoma as a public health problem. And then a lot of the experience that we've incorporated into this global toolkit comes from the experience of implementing that trachoma toolkit. And then, quite importantly, within the NTD's NGO network a couple of years ago, there was an exercise to define a comprehensive approach to NTDs, which is called the BEST framework. And when you read through the toolkit, you'll see that that framework is woven into the planning approach, and that incorporates behaviors, the environment, social inclusion, and treatment to ensure that all different aspects of NTDs are being addressed. Okay, so what do we actually have in the toolkit? So what you'll see in front of you is a very basic approach to planning. So starting from setting the program vision, to building a partnership, to doing a situation analysis so it's clear what you're trying to change and how. And then a very hefty section on planning and program design, followed by monitoring and evaluation. And those of you who do a lot of program work will look at this and you'll say, well, this is very obvious, that's what we do anyway. But the point of this toolkit is that we're trying to show how this could be done by two sectors that often have very separate objectives, and we have very specific tools and resources that support that process along the way. So just to get us started, the initial part of the toolkit gives a lot of context, which is about the need for collaboration between WASH and NTDs, defining the policies and frameworks that this is based on, but it also has a set of tools and resources as well. So first of all, a very comprehensive list of all of the different 20 neglected tropical diseases and the interventions that are needed for their control and elimination. We have a fairly comprehensive guide on behaviors and what kind of behaviors need to be included. So just to illustrate, on the next slide, this is one of the tools. Okay, so you'll see that there's quite a comprehensive set of specific behaviors that those of you who are working on behavior change may want to consider including in your behavior change program. So these are personal hygiene and food hygiene behaviors, followed by water-related behaviors, so anything from water treatment and storage all the way to preventing contact with surface water for some diseases. And then we've got a whole set of behaviors that are more relevant to the treatment and care of NTDs, but nonetheless need to be included in behavior change promotion strategies in order for them to be sufficiently comprehensive. And I'll hand over to Leah for the next bit.
Great, thank you, Yael. So as Yael mentioned, we've tried to set this toolkit up into 5 very clear steps to help walk you through each piece of the process, and each step or section covers a different topic and has associated tools. So when we're starting with step 1, we're looking at setting the program vision, and this is a very critical part of the toolkit and of the process, because what we want to do is, again, have a program vision that aligns both sectors. So it's not proving why NTD should be included into WASH or why WASH should be included into NTD programs, but how we as two sectors can set a program vision together with the hopes that if we're working towards the same goal, it'll be easier to work together. This section also identifies some initial barriers and challenges to collaboration. As we know, this is much easier said than done, but we've tried from our experience to identify some of these initial barriers, provide some kind of rationale for why collaborating is important and help bringing people together. So sometimes it's just speaking the same language, and oftentimes the health or the NTD sector speak in a certain way and the WASH sector speak in a certain way. We may be saying the same thing, but because we're speaking in different terms, we don't always understand each other. So this is important. It sounds very basic, but without those the key foundation of why we should work together, how we're working towards the same vision, and why it's important, it's difficult to start forward with any terms of program planning. So this section is a bit of a smaller section, but crucially important and very key to get started on the process. So then we move into the second section. So this is what we're calling building the partnership. So again, here we're still emphasizing and strengthening on this WASH and health or NTD partnership. So we have reasons as why you should collaborate, how you can collaborate, where to start, and some quick wins. So again, we often say we want to do a joint program, we want to have co-funding, we want to have joint outcomes, but we also recognize that is very difficult, and so we've identified some quick wins or ways to show that you can work together and show that this is a valuable and fruitful partnership to then hopefully get to the end goal of joint programming and joint monitoring. But we want to make sure that we provide easy and tangible starting points so that people aren't deterred from the beginning. So we've identified some examples from our work within Trachoma about how that can happen and what are ways to bring people together. We also have two different tools in this section. One is on messages for engagement, and this is, again, advocacy messages. What are the things that we should be saying to the WASH sector or to the NTD sector in order to speak their language and get them to work together? And then importantly, we provided a cross-sector meeting agenda and a template. So we've tried to make this toolkit as practical and useful as possible and provide as many tools that can be used and adapted within your context. So you'll see here we have a sample of the agenda for the meeting. So it's important that both sectors are presenting on their current situation, what's happening, and we provided meeting notes as well for facilitators to help highlight certain areas. Again, these initial meetings are very important because we all know if you go to a meeting and you feel as though it's not bringing value or as one sector is being under or overrepresented, it can often deter people from working together. So we've worked very hard in this section to provide a clear rationale for the collaboration, to provide evidence as to why it's useful, and to provide a very clear step process as to how this could happen. So this is just a sample of what the agenda looks like, but there is an associated PowerPoint template and facilitator notes to support this piece.
Great, so thanks, Leah. And the next section is about analyzing the situation. And again, most of us know that we need to start program design with actually finding out information about what's going on and what we're trying to address. But we find a lot of the times that when situation analysis is done from a very narrow sectoral lens, we miss out on a lot of very important information that has a lot of bearing as to whether or not the program is going to be successful. So the situation analysis protocol that we've developed for this is very comprehensive. It helps the NTD program managers understand the access to water and sanitation services in a country and in districts where diseases are prevalent, but also understand how do people use these services, what is the reason for lack of services, what sort of existing initiatives there are. So for example, as you can see in the map in front of you, this is a map of Ethiopia, by the way, and thank you to RTI and the Federal Ministry of Health in Ethiopia for allowing us to use it. But what this shows is basically where diseases or multiple diseases are prevalent, overlap with information on where WASH programs exist, and that allows us to understand where there are service gaps that then need to be addressed by the programs. We provide a lot of information as well that helps the program managers and whoever is supporting them to take that information, analyze it properly, and then use it for program design. And a lot of you will know that that's a particularly challenging part of program design often. We have a lot of information, but how much of it do we use in order to design our program? And we also have tools for presenting the information back and for identifying where partners or potential partners exist in the country, what their skills are, what's their capacity to deliver in different parts of the country in order to be able to have a solid implementation plan. Okay, this just gives you an example of the situation analysis executive summary template, and it's again acknowledging that information needs to be crystallized and summarized for the stakeholders to be able to act on in a planning setting. Okay, and this brings us to the planning section, which, as I mentioned before, is the bulkiest part of the toolkit. Because this really is when things get challenging, and we find that for a lot of disease control programs there's an easy step, which is getting people together and agreeing that we need to do something about this and we need to work together. But then when you actually come to developing a joint program, things start to become a little bit more difficult. So who pays for this activity? And for a lot of programs, if they have very restricted or earmarked funding, it's very difficult to have that flexibility in budgets. What do we do if, for example, the WASH sector does all of its budgeting in April, but the health sector does budgeting in July? How do we reconcile these planning cycles? How do we reconcile different sources of funding in order to deliver together? These are all quite dry challenges, but ultimately they can lead to failure or programs not moving forward. So what we've tried to do with this planning section is to really identify and respond to each and every one of these challenges. So the key tool here is the planning tool, which I'll show you a glimpse of in a moment, but it basically sets out the entire process with a whole set of facilitation notes, and it tries to explicitly state what usually gets left out of planning manuals. So for example, in this part of the planning workshop, you may have these particular challenges because you're questioning the status quo, you're questioning organizational incentives, and therefore as a facilitator you need to tackle those issues head on. So alongside the planning tool, we also have a very detailed agenda for how a planning process should be run, by who, what sort of information will be shared, how what you gathered in the situation analysis is used within this planning process. And then we also have things like a budget item and checklist. We have a risk register. We have specific tips for how to improve collaboration even if you have no new funding or if you have some limited funding. So doing this in different funding scenarios. And quite importantly, for a lot of NTD programs, we have a resource on how to plan for the way a program changes from conditions where you have a lot of partners and a lot of burden of disease to what happens towards elimination, where the burden is actually quite low and therefore you may not have as much funding and as much political support for the program, but you still need to get to that last mile and get rid of the disease completely. What do you do in general? What do you do specifically on WASH to get you to that finish line? And this basically is a glimpse of the planning tool. So it's just to show you that there are specific phases or steps that happen before a workshop, during a workshop, and after a workshop. And again, it's all very step by step, very well explained. And as WASH stakeholders, even if you're not running an NTD program yourself, it should help you support the Ministry of Health and other partners to be able to develop this program.
Great, thank you, Yael. So the fifth and final step that we have in the toolkit is the implement, monitor, evaluate, and adapt. So obviously a very small and simple step, but once you've gone through this process, you ideally have now a program that you're ready to implement and most importantly monitor and evaluate. So one of the things that we have found a lot is that if we have different indicators, again, we're going to have different incentives, different goals, etc. So if we can align our M&E framework and make sure that we are capturing all the relevant components, as everyone says, what gets measured gets done. So we've taken a lot of time, and thank you to those at SEI, and namely Fiona Fleming, for really taking the time to develop a very comprehensive M&E framework, which is basically a menu of indicators which you can select from that are both joint and WASH and NTD indicators. So we have aligned with JMP, we've aligned with relevant NTD behaviors, and we've made sure that we have a very comprehensive list of indicators that can be selected and chosen from depending on the design of your program. So this is a very comprehensive and useful tool that is a large chunk of this section. Not only do we have the template log frame and indicator menu, but we also have a routine supervision form. So we know a lot of times with joint supervision, we've identified specific, again, sample activities that you can monitor together to encourage and to cement the collaboration. We're looking at a program dashboard template. I think a lot of times simplifying these things into a very clear visual template or dashboard can be useful for higher level and to help with advocacy and engagement. We have a template for the Gantt chart, we have the program risk analysis, and then in addition to this log frame and indicator menu that I've mentioned, we have the definitions and checklists for log frame development. So it really takes us through the process of how we should define our outputs or outcomes, etc. Again, very common in program development and planning across all sectors, but the key here is how do we engage both sectors, bring them together, and have joint indicators and joint outcomes that we're working towards. So this is just, again, an illustrative example of the log frame template as well as the dashboard template. So we've also tried to color code the various levels within the log frame to make it very clear. You can select which ones, again, are relevant. So all of these are meant to be samples, but are, again, tailored for whichever context or program design and implementation you have reached. And then to the right, again, you see a sample dashboard template that highlights some of the key areas that you'd want to show, such as NTD prevalence and WASH-related indicators. So the log frame template and menu is a very large tool, as I mentioned, and this is just a sample to give you all a taste of what it looks like. So in terms of the contents of the toolkit, those are the 5 main steps, and now I'm sure the question is how can you use it or access it, and we have 2 different ways in which the toolkit can be used and accessed. One is this printed version, which I'm holding here. I realize it's difficult to see, but it is a printed version of the toolkit with all the appendices, all the tools, and all the steps that we've just talked about. And as you can see in the picture, the idea with the toolkit, the printed version, is to make this very easy to navigate. So the various steps are highlighted on the side, the facilitator notes, and all of the tools are included within the section. And this is also available as a PDF on the WHO website, which the link should be provided at the end, and can be downloaded and accessed. So again, this is just to show another way that we've really tried to think about the design of the toolkit and make it very easy to use. If you want to look at a certain section, you're guided by the tabs on the side. You then have the various tools associated with each of those steps that we've just briefly highlighted. And then another thing that we're very excited about is that we have an online version of the toolkit. And I'm not sure if we don't think we did. Okay. We had a nice little video, but we'll go with this for now. But the idea here is that we have an online version of this toolkit in hopes that this will make it easy to adapt and use. So the online version has everything in the printed version optimized and laid out for online, so you can access the different tools. You can download all of the tools for the toolkit For the toolkit, you can download tools from a certain section. You can easily navigate between the sections on the top toolbar. And the idea is that while we will have some printed and the PDF version available, we'll have this online version also, which we hope to update at least every 6 months and make sure that with the feedback and after people have been using it, we're easily able to update it and this document is kept live and relevant. So again, we recognize online versions can be difficult in some settings, which is why we've provided the PDF and printed version, but we also want, where appropriate, the online version to be used and to be seen as a very kind of, there's areas to give feedback, a very living document, and we welcome as much feedback as possible. So with that being said, what's next and what can you all as WASP practitioners do? I think namely is using this toolkit and provide feedback. As I mentioned, this is version 1.0 and will be updated on an ongoing basis. So there's an opportunity and a way to provide feedback directly on the online site. We're really interested in learning how this has worked. Again, as Yael and Sophie mentioned, it's based off of country experience, but there's also always more to learn, and we know that this is not the final version by any means. So any feedback and experience you have, positive or otherwise, is very much welcome, and you also have Sophie, Yael, and I's emails at the bottom of the screen if you'd like to email us and ask anything directly. We're always happy to work with you all on that. Also documenting and sharing your experience of using the toolkit. We've developed these webinars, and this is the first of what we hope is a series of webinars on the toolkit, obviously starting with an introduction and what the toolkit entails, but hoping as we go on through the webinar series to highlight countries and experiences from programs and partners that have used the toolkit. So if you're using the toolkit and you have had a good experience or you have something you want to share, please also let us know so that we can make sure to share with the broader audience. I think there's nothing more useful than hearing how someone's used it in their setting and how it's worked, and we really hope to provide some more concrete examples going forward for you all. Another thing I think is that we have titled the toolkit WASH and Health Working Together, and we really want to understand how maybe this can be adapted or used to other cross-sector collaboration. So WASH and nutrition is obviously a big opportunity, and again, a lot of these principles in this toolkit are basic program planning principles, but we really try to apply it to a cross-sectoral situation. So we welcome any other adaptations or using this to work across other sectors, and please feel free to use this as a guide or reference, however it may be most useful for you in your settings. And then again, as I mentioned, just be on the lookout for other webinars that are highlighting country experience and use of the toolkit, and please let us know how you're using it and if you would like to be highlighted. So before we move into the questions, I just want to thank all those that have been involved in the toolkit. As Sophie and Yael mentioned, it's been a very long process, a very collaborative process, and we'd like to thank the NNN and the WASH working group of all the members that have been part of that, the WHO, and mainly the Water, Sanitation, and Hygiene Unit, as well as the Department for Control of NTDs. And then we had some very strong and willing country partners from the Ethiopian Federal Ministry of Health, Nigeria, and the Carter Center Sudan, who tested a lot of these tools and are really spearheading a lot of the in-country experience that we've been able to gather. And then the UK Department for International Development and the Queen Elizabeth Diamond Jubilee Trust for their funding. So again, thank you to everyone who's been involved. Thank you to Susanna and the team there that's helped us organize the webinar. And I think without further ado, we can move into any questions or comments you all may have.
Back to you, Sophie.
Okay, thanks Yael and Lee for this really great overview presentation. I'm switching on the camera again. So I have a few questions here. So one from Hanky, who's asking, has the tool been tested in any country? And I think you partially answered that response, but perhaps you want to elaborate a little bit more of the country experience with the toolkit?
Sure. Thanks for that question, and it's very valid. Yes, absolutely. I wouldn't say we've used the entire toolkit in one country. It's more that the different tools were used in countries or actually emerged from processes in countries. So I'll give a couple of examples, and I'm sure Leah's got a few more. So a lot of experience in Ethiopia, developing the experience that then led to the planning tool. The joint indicators I know have been used in Mozambique and in Angola by the Mentor Initiative, and in all of the trachoma funded programs, the ones that are being funded by the UK Department for International Development and the Queen Elizabeth Diamond Jubilee Trust, although we've added more to those as well for other diseases. And in, I think it was Cameroon and Niger, there was a lot of experience in Guinea working on harmonizing behavior change messages in line with the process that we're suggesting in the toolkit. Any more examples? Maybe Sudan?
I think also, yes, in Sudan we did the workshop specifically looking at trachoma and the facial cleanliness and environmental improvement aspects. So we did the planning workshop in a country that didn't have large-scale trachoma funding. So that was another place where we got the idea of the quick wins from. So if you don't have a lot of money, this can still be done, and there's ways in which we can do it. And we saw a lot of engagement from the WASH cluster leads in Sudan and have had some promising outputs from that. Yael mentioned a lot of, so Uganda, Malawi, Tanzania, and Kenya all use the joint indicators for the framework, and that's really helped engage at a ministry level as well as a partner level. Looking at the same indicators just creates that natural joint interest. So we've had a lot of experience from that, and this toolkit looks beyond just trachoma, as you mentioned, and looks across all NTDs. So we're very excited and eager to see how this applies to more NTDs within the sector.
Thank you for this complete answer. So just picking up another question from Arno, is there an outreach plan for targeted country health ministries?
Yes, you could say that. We've got quite a large communication strategy. So, for example, in a couple of weeks' time, we'll be presenting the toolkit to in the Carter Center Trachoma Program Review, which has ministries of health from 8 sub-Saharan African countries. It will also be shared in WHO-run regional and global meetings for NTD program managers. We have also submitted proposals to present at Stockholm World Water Week and in the UNC conference on water and health. And then there's more targeted approaches. So, for example, with the Schistosomiasis Control Initiative, we work directly with ministries of health, so we'll be using the toolkit through that. And we've also built toolkit use into funding proposals for implementation in 31 other countries. So, absolutely. But we're relying on you also to help us push it forward.
And if there's any countries that you feel are missing or you'd like specific outreach, then please let us know. So I think especially we have a lot of focus in the sub-Saharan African countries, but if there's programs or projects you're working on in any of the Asian or Southeast Asian countries, we very much welcome any engagement on that.
And just to add to that, to preempt the next question on other languages for the toolkit, it's being translated into French, and we will be laying that out pretty soon, and then hopefully get to translate it to other languages as well.
So there's actually asking about countries. There is one question from Yuri who's asking if you have any ongoing program in Honduras.
Okay. Well, obviously, there are NTD control programs in Honduras. Those are led by the Pan American Health Organization from a WHO perspective. I'm not exactly sure what sort of approach is implemented, but the Latin American countries tend to have usually quite a comprehensive way of addressing diseases and do tend to do integration a bit better than we see in a lot of the other continents. So be interested to hear how you think the toolkit can be used in Honduras and what's a valuable entry point. But I don't think either of our organizations currently is working with the Ministry of Health in Honduras.
So just, I have another question from Tapos, who's asking, do you have any related monitoring tools? So the monitoring side has been covered in the presentation, so I was not sure if that was a clarification question, or whether that, it was related, if that question was related to additional tools that may not be included. But perhaps you want to kind of, perhaps you can just say a few words about the monitoring tools again.
Sure. So just on monitoring, so I would suggest having a look at step 5 of the toolkit that really starts off setting out what monitoring is for and what are the different ways of monitoring and what it responds to. So we've got monitoring for accountability, and there's routine monitoring, and there's impact monitoring. And then we have tools associated with each of those. So obviously the log frame is a very big part of that, and hopefully quite a useful one. Routine supervision is for routine monitoring, so actually going out to the field and checking, is the program working as needed? And then we have various aspects of evaluation covered as well. Hopefully that's comprehensive enough, but if there's anything that you think we're missing, there are any gaps in terms of monitoring, please get in touch with us, because that's a very important issue that we'd like to cover comprehensively.
Great. Great, thank you for this clarification on the monitoring side. Another question from Arno, who's asking what NTDs should street latrine workers be more aware of? Is the toolkit something for this target group?
So Arno, is this people who are working in emptying pit latrines, I'm assuming?
I would assume so.
Probably. Yes, okay. Great question, thank you very much. So, people who are working in pit emptying should be on the lookout for a whole set of diseases, and a lot of them are not neglected tropical diseases by definition. And I would refer people as well to the new WHO guidelines on sanitation and health that cover quite a lot this area. But maybe of particular interest are helminth infections such as Ascaris, hookworm, and Trichuris. So anyone who's working in pit emptying should probably be treated for parasitic infections quite regularly. And then there's also other things such as diarrheal diseases, cholera, typhoid, and anything basically that's fecal oral in its transmission.
And I think just to add, Yael had briefly highlighted the NTD related behaviors in section 2 of the, or in the background of the slide, so toolkit, excuse me. So we have all the sanitation, hygiene, and treatment and care and water behavior. So for each one, we would name the practice, the purpose of this behavior, and then which diseases it affects. So we just briefly flashed that on the slide. I know it went by quickly, but that looks at the different behaviors associated with water, sanitation, and hygiene, and which diseases it specifically addresses. So it's another useful resource.
Great. So I wanted to kind of ask a question to the audience. Well, it would be great to hear from them, whether they've worked with, from the WASH perspective, have they worked with the NTD programs, and whether they faced some challenges So I'm just encouraging the audience to comment on that and share their experience. But while they think about it, I'm just trying to see to look for the next question. Yes, there's a specific questions about does the document mention how to establish indicators that can help reaching some financial funds to support these programs?
Okay, so okay. So we have a lot of guidance on developing indicators, and indicators are of course fundamental to having the right funding proposals in place, because they help you explain how the program that you will be delivering on the WASH side will contribute towards achieving specific health outcomes in terms of disease impact, and also in terms of strengthening the health system. So absolutely yes, and that's what step 5 of the toolkit is dedicated to. But in terms of advice on obtaining funding, that's what step 4 refers to. So we have tips for the various funding scenarios that we discussed earlier. That's also incorporated into the planning tool as well. But also just taking you back to the messages for engagement, that tool is basically, resource is basically on how to sell the issue of collaborative WASH and NTDs programs to a whole set of different audiences. So not just WASH to NTDs and NTDs to WASH, but also WASH and NTDs working together to sell this idea to the health sector more broadly, to the nutrition sector, to the corporate sector, to the education sector, to vector control, and hopefully that also provides arguments for that can be built into funding proposals as well.
Okay, thanks a lot. I hope it's clear for Yuri. I hope that answers your question. Maybe perhaps Yael and Leah, you want to kind of comment on some of the challenges, the most common challenges that have been found when you were actually developing the toolkit, and that came up, in the context of country programs.
Do you want to start?
Sure. I think one of the major challenges we faced, and part of the reason for highlighting that setting the program vision and building partnerships, was just getting people in the same room. I think oftentimes everyone is busy, everyone has deliverables and goals that they're trying to reach, and often how the fundings and programs are traditionally set up is very siloed. So by asking someone to come to a meeting, you get people are very interested and they can't come, or it's not always prioritized. So I think we found that as a challenge, just because we did feel there was a lot of interest and engagement, and I think thanks to the WHO and a lot of work they've done with establishing the joint WASH and NTD strategy, we were at a point where we were no longer proving the need for WASH and NTDs, but then we were moving into the action part. So I think we did face a lot of challenges on that, and then again, one thing that helped us overcome those challenges was oftentimes looking at the WASH and NTD data side by side, or identifying these kind of common things, or that you would say in the middle of a Venn diagram, and kind of recognizing we all are working on the same things. Oftentimes NTDs affect the world's poorest people. The lack of water and sanitation is often worse in these same areas. So finding that common ground and realizing it wasn't getting them to come or getting two sectors to come to meetings that weren't relevant, but that was part and parcel, and ultimately we were working on those same goals and kind of achieving those SDGs that Yael had showed in the first slide. So I think getting the initial interest was a challenge, but we've also had some very positive experiences in Ethiopia and Nigeria of really engaging both sectors, which has been very promising to see. So a challenge, but also a happy ending in some cases.
Thanks, Leanne. And on my side, I'd say one of the challenges is actually sustaining that initial good momentum. So that's something that I think we come across quite a lot, in the sense that people sort of have a very big ambition when they start collaborating, and then if it doesn't work immediately, there's a kind of tendency to give up, or maybe go back to how we're used to doing things, and to very entrenched kind of ways of working. So what we've tried to do with this toolkit is to encourage people to start where it's easiest to start, do something that it's very easy to collaborate on, maybe not that expensive, maybe not very high risk, and then build on that success to gradually increase the ambition of your program. But don't try to do everything to begin with and then give up when you fail. And that's basically one of the key principles of adaptive planning. So we start, we try an idea, we go back, see how it worked, build on that, and then gradually grow that momentum.
Great, thank you. I have, so excuse me, we have another question from Adam, which is related to the donor and funding. So I'm just going to read it. Can you talk a bit more in general about the donor environment and appetite for this intersection? Are donors putting money behind WASH and NTDs in general? And are there subsectors, for example, WASH in healthcare facilities or WASH in schools, related to WASH and NTDs, where you are seeing donors prioritize?
Okay, that's a great question. Thank you. So yes, in general, I think we are seeing that there's increased momentum around, it's not necessarily funding WASH and NTDs, but it's funding comprehensive programs that address both of these issues. It's very easy, or an easier sell in trachoma that has a very defined framework or strategy called the SAFE strategy, which has surgery, antibiotic, facial cleanliness, and environmental improvement as the four main pillars of trachoma control. So when donors fund trachoma programs, they tend to fund all of that. Whereas in some diseases, most of the funding usually goes to mass drug administration, but there's a movement towards programs that go beyond that to look at prevention as well through WASH. I won't name specific donors because I don't think it's appropriate on this platform, but I would say there are a few progressive donors that are doing that increasingly. Of course, we can always do more. I'm not sure that I would say that that NTDs or WASH and NTDs as an issue is specifically prioritized in funding for WASH in healthcare settings, but in a way there isn't really an argument for that. I think WASH in healthcare facilities is something that just needs to be funded as part of healthcare services. If you build a healthcare facility, it needs to have adequate WASH in it, which also prevents transmission of infection and protects patients and staff. We do cover relevant behaviors in the toolkit, but I wouldn't say that it's kind of being funded as an issue. WASH in schools, yes, I would say there's probably quite a lot of momentum around at least behavior change for NTD control within school health programs that include WASH, so through things like school health clubs, etc. Not sure yet that we're seeing that there's any evidence that we're seeing more investment in WASH infrastructure in school as a result of this, but hopefully yes.
And I would just add to that I think as these joint programs are being developed and implemented and we're finding examples of them, we're also trying to document them and kind of provide examples to the donor audience. So even within the trachoma programs, we're trying to maybe do a small cost-benefit analysis and see how we can identify some clear messages to bring to donors. That's been a request out of some of the NTD meetings we've had, that if donors can see the benefit and have some examples, it makes it easier for them to talk to their higher ups or powers that be in that regard. So that's something that as we are seeing more joint programming, we also want to make sure we document it not only from a programmatic side, which is very important and which is where this toolkit focuses, but also looking at other audiences such as funders and how we can make sure that we are catering to them in any information they may need. So hopefully more to come as well.
Super, thank you. This was a very comprehensive answer, and just to kind of starting from these kind of success stories, can you perhaps elaborate a bit more about the Ethiopia case, country work that has been done? I think that's a great example, and it would be useful, I think, to hear more about it.
Sure. So just also being cognizant that we're running up on time, I think Ethiopia has been a great champion in looking at joint Washington NTD work. Again, thanks to the WHO for providing the leadership with the strategy, the Ministry of Health in Ethiopia has really taken on Washington NTDs as one of their priority areas for fighting and eliminating NTDs. So they've been able to, from a Ministry of Health side, they've also engaged with the environmental hygiene section within the Ministry of Health, which we've found has been very useful. So again, it's bringing these two, not just the NTD department, but also the environmental health and hygiene department together, having conversations explaining why this collaboration is necessary. And once we have, they had provided that kind of common ground, there's now been movement into national Washington NTD task forces, which have resulted also in regional Washington NTD task forces, and we're hopefully getting down to the district level this year in terms of cascading these task forces and platforms. So another thing that has come out of Ethiopia is this need for joint planning, and in order to have joint planning, kind of bringing, I think both the WASH and NTD sector have a wealth of data on their various topics, and bringing this data together and showing where there are opportunities for decision making has been an interest of the Federal Ministry of Health and a request that we are trying to push forward also. And then again, showing some examples. CARE did a really great intervention in Ethiopia that showed how much it would cost to add NTDs into their routine WASH programming. And that has also spearheaded a lot of interest from the WASH sector, showing that it's not that expensive to add WASH. They said about 10% to add NTDs into your WASH programming. So I think there's been a lot of great leadership and examples, and we found that providing these concrete examples to the Ministry of Health and to partners has really gotten people's interest. Again, talking about the collaboration and the need for it is very crucial, but then being able to have tangible examples which Ethiopia have provided has been really useful to continue the momentum that has started. So not wanting to run too much over time, but if anyone is interested more in Ethiopia, happy to speak further as well.
Great, thank you, Leah, for these details. And I'm just really conscious of the time now, so I think we'll have to wrap up the webinar. But some of you were asking where they can download the toolkit, and so we've shared the link with you. There will be a recording available of the webinar on the Susanna website, so that you can share with other participants who perhaps have registered but who have not been able to attend. So with that, I just would like to thank again everyone for joining us on this webinar today, and hopefully we'll give you further thoughts and ideas in your respective areas of work to try and improve and the way we work together with NTD and WASH actors. So thank you everyone, and have a great day or have a great evening.
Thank you everyone.
Thank you.